Okay, I'm gonna start with my. I don't have nothing here. I have nothing here. This is the card I'm gonna use for his cover his eye. I'll show you the room. It's a very small room. This is where I have the telly. Nothing else. Yeah, that's pretty much it.
Come in.
Hello, my name is Nancy. I'm going to be your student nurse. I'm going to provide privacy and I'm going to do my hand washing. I'm going to pretend that I have gloves, but I don't have gloves, but I'm going to say that I do have gloves. I'm going to identify my patient. Can I have your name and date of birth, please?
Ismael Martinez, April 25th, 1984.
Do you have any allergies to food, medication, lactase, or environmental?
No.
Okay. He does not have any allergies. How old are you?
36.
What is your occupation?
Electrician.
Okay. What is your marital status?
Married.
Okay. I'm gonna give you 4 words, and after those 4 words, I'm gonna ask you about them later on.
Okay.
The color is red, blue,
Red, blue.
green, and yellow.
Okay.
Can you repeat them?
Red, blue, green, and yellow.
Okay. I'm gonna explain what I'm gonna do. I'm gonna do an assessment on you, and I'm gonna start by taking your vital signs.
Okay.
Okay. Once I get that question out of the way, that the color, I'm gonna ask him, have you had any surgeries, breast or axillary surgeries?
No.
No. And that's for his blood pressure. He does not have any PICC lines or IVs that will for his blood pressure, and he does have his nails are short and does not wear any nail polish, so that will not interfere with the reading of the oximeter. I'm gonna start by taking his vital signs. And I'm gonna start by taking his temperature. Mr. Martinez, can you please open your mouth and lift out your tongue? Okay, close your mouth. Okay, okay. While that is going on, I'm gonna check for his pulse. Okay. Everything has been disinfected already. Stop right there. Because of time, we have to do it a little quicker. So his temperature was 98.6 and his oxygen was 96%. I'm sorry, this thing. His temperature. Now I'm gonna do his check for his pulse and his respiration. Now I'm gonna do it for 30 seconds each. Okay. His respirations were 20. Normal even pattern. Respirations 20. And his pulse was 64, 2 plus. Did not skip no beats or anything. Now I'm gonna do I'm gonna mention my normal value. My normal temperature range is 98.6 to 100.4. For pulse is 60 to 100. For temperature is 12. I'm sorry. For respirations is 12 to 20, and for blood pressure is 120/80. Less than 120/80. If there was a 20-point difference, I'll notify provider. And I'm gonna start doing his blood pressure right now. And this is a 2-step blood pressure. I'm gonna pump until I can no longer feel his pulse. I'm gonna release, and then I'm gonna go 30 above the number. Okay, do you have an arm preference, Mr. Martinez?
No.
Okay. Okay, I'm gonna feel for his brachial artery, which is right here. He's about 130. Is that okay with you?
Yeah.
You want me to continue? Okay. If it was somebody else, I'll wait a minute and I'll ask him if it's okay with them to continue, or I'll switch it to the next one. So it stopped at 130, so I'm gonna go up to 160. His blood pressure was 128/80. 128/80. Okay, I already did the vitals. Now I'm gonna go and see the reason of his visit. What brings you into the clinic today?
My knee hurts.
Okay, tell me about your pain since it started until you came.
It started yesterday.
Oh, it started yesterday? Okay, since he mentioned his pain, I'm gonna do the pain assessment. Okay, does the pain, what makes the pain better or worse?
When I walk, it hurts.
Okay, can you show me where the pain is?
Right
Okay.
in my right.
Okay. Does the pain, is it sharp, dual?
Sharp.
It's sharp pain. And, okay. And okay, from 0 to 10, how will you rate your pain?
5.
Okay. Have you taken anything for that pain?
Tylenol.
Tylenol. It doesn't seem to work anymore?
No.
Okay. What are the things that you're not able to do because of the pain?
I cannot walk far.
You cannot walk far. Okay. Does the pain, does it come and go, or is it constant?
It's constant.
It's constant. Do you have any other pain?
No.
Okay. Since he doesn't have any pain, any other pain, I'm gonna do his health history. Are your vaccines up to date?
Yes.
Have you had the flu vaccine this year?
Yes.
Okay. Have you ever been diagnosed with, as a child, of the measles, mumps, or chickenpox? No. Have you ever been diagnosed with the following? Asthma, cancer,
No.
diabetes, no chronic illness? Okay, I'm gonna ask him about his family's health. Has anyone in your family been diagnosed with asthma, diabetes, cancer, no chronic illnesses?
No.
Okay, no high blood pressure. How about your parents? How are their health?
They're good.
They're good. How old they are?
59 and 60.
Okay, I'm gonna move on to the functional. What's the highest level of education you accomplished?
College.
Okay. Do you think your lifestyle is according to your financial situation?
Yes.
Do you have any beliefs or religion beliefs that I should be aware of?
No.
On a typical day, what do you do since you get up and you go to sleep?
I get up, I go to work, and then I come from work, go home, and then go to sleep.
Okay. Do you drink or you smoke?
I drink, but I don't smoke.
Since he drinks, I'm gonna ask him for the alcohol questions. On a week, how many days do you drink?
Every day.
On a day, how many drinks?
One or two.
Since he, because of his drinking habits, I'm gonna do the Cage assessment. Has anybody mentioned you to cut down on the drinking?
No.
Have you been angry because somebody say something about your drinking?
No.
Have you felt guilty of your drinking?
No.
Have you had an eye-opening
No.
of your drinking, like getting up in the morning and have a drink?
No.
Okay, he does not have any problems with that. I'm gonna do now I'm gonna move on to the depression. These couple days, these past 2 weeks, have you felt depressed or hopeless, loneliness?
No.
No. On these past 2 weeks, have you felt that there's been a change on the things that you used to enjoy and they don't bring you pressure anymore?
No.
Okay, if you would say yes to either one question, I will do the PHQ-9 screening, and I will include these 2 questions. Do you feel like life is not worth living?
No.
Have you tried to hurt yourself?
No.
Okay, he did that. Now I'm gonna assess the domestic. Because domestic violence is so common in our society, we're asking everybody the following questions. Do you feel safe at home?
Yes.
Has anybody tried to hit you, punch you?
No.
Your partner? No one? Okay. If he would say yes, I would have performed the danger assessment. Okay, now move on to his appearance. He is his body is erect, poster. He is well dressed according to the season. He's well groomed and hygiene. For behavior, I'm gonna ask, he is alert, his speech is clear and is not slurred. For his cognition, do you remember the 4 words that I asked you earlier?
Yes.
What were they?
It was red, blue, green, yellow.
Okay. His recent memory is, I'm sorry, my tablet. His recent memory is good. Do you know where you're at?
Yeah.
Do you know what time is it?
Yeah.
What time?
It's 6 o'clock.
He is oriented to time and place. Do you remember the 4 presidents?
Yeah.
What is it?
It's a Bush, Obama, Trump, and Biden.
Okay.
Biden is the president.
Yes. He has a good remote recent memory. He is not suicidal and he does make sense. Okay, now I'm gonna go ahead and move on to, I already did that. I'm gonna move on to the nutrition. I'm gonna ask you if you can please stand up here so I can give you a height. Okay, you're good. 68 inches. Okay, if you can please stand up. I already zeroed it out. If you can stand up right there. Okay, 180. And I'm gonna measure your waist for your waist circumference, which is 36. 68, 180. I'm gonna go ahead and do my BMI calculation real quick. 68. 180 divided 46, 24 equals 27.4. 27.4, and he is 180. 2.2 equals 81.8 kilograms. Here are my calculations. His BMI is 27.4, 81.8 kilograms, 180 pounds, and his waist circumference is 36 inches. Now I'm gonna move on to do the Sleming chart. If you can please stand up here, and it's been 20 feet from here. I'm gonna give you this card. Does not have anything. Can you read the line? What's the line that you can read?
No, number 5.
Okay, what's the number? Can you read it?
PECFD.
Okay, can you cover your left eye? Can you read it? What's the line that you can read?
PECFD.
Can you cover your other eye? What's the last that you can see?
PECFD.
Okay. Thank you. The patient does not have any squinting or leaning forward. He has a 20/20 vision. If he didn't, I will refer him to an ophthalmologist. Okay. Now that I did his vision, which is 20/20, I'm gonna check for his hair. I'm gonna inspect his hair. He does not have any missing patches. He does not have any patches of hair missing. His hair is not brittle. It's not dry. It's healthy. He's not missing any hair. His hair is normocephalic. And I'm gonna inspect. He's not have any depressions. He does not have any lesions. Now I'm gonna check for his ears. I'm gonna check your ears real quick. If you feel any pain, please let me know, okay? I'm gonna pull the pin out. Do you feel any pain?
No.
Do you feel any pain?
No.
Okay, I'm gonna push on the triggers. Do you feel any pain?
No.
Do you feel any pain?
No.
I'm gonna check the mastoid. Do you feel any pain?
No.
Do you feel any pain?
No.
Okay, he does not have any pain. I'm gonna check for his mucus opening. He's normal. He does not have any secretions. If he did, I will make sure I'll document. He does not have any inflammations. And same here, he does not have any inflammation. If he did, I will make sure I'll document for the color and the texture of the secretions. I'm gonna check his eyebrows. His eyebrows are symmetrical and evenly distributed with the hair, same as the head. Okay, I'm gonna check. Can you close your eyes? Can you open your eyes? He does not have any problems opening and closing his eyes. I'm gonna. Can you put your mask down, please? Okay, I'm gonna check his conjunctiva. Okay, can you look up? Okay, conjunctiva is moistened, pink. Can you look at the other one? Okay, they're both moistened pink, and his sclera is white. He does not have any infections or inflammation. His lips are moist. He does not have any dry lesions. Can you open your mouth, please? Okay. Can you stick your tongue out? Okay, he does not have any tonsillitis. He does not have any missing teeth. He's not having any white patches or any lesions. Close your mouth, please. Okay, I already did that. Can you puff your mouth? Can you smile for me? Okay, good. His nasal labia is symmetrical. His skin is according to his heritage. Do you have any wounds or lesions that
No.
should be aware? If he does have any wounds, I will assess by the location, the executive, which is the color, the odor of the wound, the size. And for the lesions, I'll use the ABCD, which is the ABC, asymmetry, the B, the border, the color, the diameter of less than or more than 6 millimeters. I'm sorry, and the elevation, the symmetry, elevation. Yes, the border. Okay, I will make sure I'll document that. Now I'm going to do some range of motions. If the neck is erect to his head is according to his body size. I'm gonna ask you to follow me. If you feel any pain, please let me know. Okay? Can you look up, backwards? Now forward. Now side. Look to the. Okay, that's chin to shoulder. Now the other side. Now look to your right. Now look to your left. Okay. Now I'm gonna do his hearing finger rub test. Can you close your eyes, and whenever you hear something, lift up your hand. Okay.
Okay.
The patient does hear and he does participate in the conversation. Once I get that out of the way, his eyes protrusion, his eyes eye sockets are stable; they're not going anywhere. His exophthalmos is protrusion of the eyes, puffing out, and anophthalmos, I'm sorry, I can't say it, is the sinking of the eyes After that, I'm gonna assess his skin, which I already asked if he had any wounds or lesions, and he said no. But I'm still gonna inspect to see if he's missing any hair patches or any uneven on the collar. I'm gonna check his legs, and I'm also checking for edema, which he does not have. And if he did, I'll rate it as 1+, mild, 2+, moderate, 3+ deep, and 4+ very deep. And he does not have any edema. And I'm gonna check you back. I'm sorry. He's good. I already did the range of motion. I already did his eyes. I'm gonna check for his nail capillary to see. Okay, his nails are normal. They're not brittle. They're not beating. His reflex, oxygen reflex, is capillary reflex is good. Yes, everything is good. His skin is good. What else do I need? I think I did everything. Just double check that I'm not missing anything else. I did the vitals. I did the questions, the BMI, the height. I did his eyes, the rubbing test. I checked for his meatus, external meatus, that he didn't have any secretion. If he did, I will make sure I will note for the color and the thickness of the secretions. He does not have any secretions on the eyes either. No infection. The eyelashes are fully patched. He does not miss any eyelashes or eyebrows. He does not have any trouble opening or closing his eyes. He does not have any missing teeth. His color is according to his heritage, and his nose is symmetrical. It's in the middle. His ears are symmetrical also. They're not one. It's not uneven. His head is normocephalic also. And I think that's it. I think I got pretty much everything. I feel like I'm sorry. I feel like I'm missing something. That's it. He does not have any edema. His pulse rates were good, reading normal. Okay, I think I checked for his meatus. I checked for his, if he had any pain. He didn't have any pain. I did the range of motion. He did not have any pain. His neck is erect. He is normocephalic. The eyes, the sclera is white. The conjunctiva is pink and moist. His lips does not have any lesions, either his inside of his mouth. The skin is intact. He does not have any lesions either. He does not have any edema. The nails are not, he's not missing or beating his nails. He has good oxygen perfusion, reflex. And I inspect his hair, his skin, which is according to his heritage. He didn't have to remove his shoes on the weight or the height, but in a clinical setting, I would ask him to remove it. I think took his vital signs. I think I got everything. These are my papers. That's pretty much it. I think I addressed everything. I will disinfect my hands, remove my gloves, disinfect my hands, and notify provider. Thank you. I'm gonna let the doctor know about it.
Thank you.